Well, good evening, everyone. We want to thank you all first for coming out on a Wednesday night at 5:30 to the Atrium at Government Center for this very important work we're doing. We're finding a way to make an impact with our opioid settlement funds. First thing I have to do is thank the committee. They've been working tirelessly on this to try to find the best way that would have the biggest impact in a very, very difficult battle that goes on every day in every neighborhood across our city. I know it's hard work, but we're looking for ideas, and we really appreciate everyone taking time out of their busy schedules to join us tonight. The person that's been spearheading that committee is our Director of Health. I want to turn it over to her, Tess Curran.
Thank you, Mayor. And I would just like to thank Brianna Raposa in my office, who's been doing a tremendous amount of work on this as well. And so I'm very appreciative of all the work you've put in for that, Brianna. So this evening, again, thank you for being here. We will be doing an overview of the funds, the payment structure, the spending to date, general commitments, allowable fund expenditures, the committee structure, the timeline of key dates, and discuss the RFP. At that point in time, when I'm completed the presentation, we'll open it up to citizens' input. Again, if you haven't already done so and you're interested in speaking, please sign up, and we will be having folks speak for three minutes. So the Massachusetts Opioid Settlement Funds, Massachusetts and the City of Fall River has participated in the nationwide financial settlements with several companies as part of the historic legal efforts to demand abatement of the harms caused by the opioid epidemic. Massachusetts will be receiving an estimated $900 million through these settlement funds for substance use prevention, harm reduction, treatment, and recovery support. Of those $900 million, 40% is going to municipalities, and the remaining 60% will be allocated to the state's opioid recovery and remediation fund. At this time, the payment structure, the City of Fall River received the first payment in July of 2022. We're estimating to receive about 81 payments until 2038, with the last payment coming in the fall of 2038. We are still learning and gaining a sense of when the payments are coming in. We, at this point in time, have more money than we had originally been anticipating to date. So the payments are coming in at a variety of different speeds and payment structures, but it can all be tracked through the mass.gov website. That is also now linked on the City of Fall River's page. So it is publicly available information, and anybody's able to take a look at that. At this point in time, the City of Fall River has received $1.8 million of opioid settlement funds. And over the next 15 years, we expect to receive nearly $8 million. Again, while this is a unique opportunity, and we are certainly taking great consideration when we're receiving these funds and spending these funds, the reason why the City of Fall River is receiving such a significant amount of money is based on the impact that opioids have had on the community. That certainly doesn't go without a heavy heart on the City of Fall River, the administration, health department team, the advisory committee. We are understanding certainly the need here in the community, but the impact and the reason why we're getting so much money is because of the impact that the opioid epidemic has had on Fall River and the number of lives of Fall River residents that have been lost. So at this point in time, the spending to date in spring of 2023, we contracted with PIRE, the Pacific Institute for Research and Evaluation, to conduct an evaluation report. That report is also available on the City of Fall River's website. This was done through the Substance Addiction Task Force. Individuals who are participants in the task force and who work within the industry were interviewed with the PIRE team, and goals, current capacity, and future direction were determined through that interview process. Again, we encourage everybody to take a look at that report, and it's available on the city website. In fall of 2023, the city contracted with PIRE again to support the Fall River Opioid Settlement Advisory Committee and draft grant proposal materials and applications. So to date, these contracts have totaled $99,000. The state is really outlining what we can spend funds on and how money can be allocated and where it can be placed. So at this point in time, funds are held in a stabilization fund that's separate from the city's general fund. But at the time of our first payment, the state had indicated that that was the required place for us to put those funds. To dispense stabilization fund money, mayoral and city council approval of a 2/3 majority vote is needed. Again, I'd encourage anybody who's interested in learning more about the 8 abatement terms, including details on allowable expenses. They can review that on the mass.gov website, and we also have it here at the Fall River Opioid Settlement Funds page. So the funds, not only the state is outlining this, but the city certainly wants this as well to reflect input of our communities for people who have personal experience with the opioid crisis, experts in treatment and prevention, and the staff and organizations that are carrying out this work. So again, we've heard from and will continue to hear from individuals who work in the industry, again, through that strategic planning process, and I see a lot of familiar faces here as well. To address existing disparities in services, outcomes, improvements, taking specific care of those in disadvantaged communities, to address mental health conditions, substance use disorder, and other behavioral health needs, and encourage innovation, fill gaps, fix existing shortcomings of current approaches. So the opioid settlement funds can't be used to supplant existing services. The funds need to be used to expand or improve upon existing services. The state has created a list of allowable expenditure categories. These include opioid use disorder treatment, so things like expanding mobile interventions and treatment, supporting treatment and recovery, so things like housing, job training, transportation to treatment, connections to care, so things like post-overdose response teams, supporting emergency medical services, things like safe stations, harm reduction, so increasing access to naloxone, including naloxone training, syringe services programs and mobile units, criminal justice needs, so post-prison or jail release programs, harm reduction treatment, or public safety diversion programs. And some of these are just examples that I'm giving from each category. Supporting women and families, so home visiting programs for parents in recovery, pregnant or postpartum treatment programs, and then prevention efforts. So things like community-based education intervention, increasing access to supports for youth. So at this time, then, the advisory committee is ongoing and meeting monthly. In November of 2023, the City of Fall River convened the first meeting of the advisory committee. These individuals, some of whom are here this evening, are tasked with providing recommendations on opioid settlement fund spending. The individuals, it's a 10-person committee. These are volunteers, so we are very appreciative of them being here tonight and of their time each month, and have various backgrounds, including religious communities, community-based organizations, Fall River business owners, municipal finance experts, and those with lived and personal experience with the opioid epidemic. So these individuals live and or work in Fall River. They're invested in the community, and we're really happy to have them on board. So the current strategy, phase 1 has been completed, which was the strategic plan work. through the Substance Addiction Task Force and through the individuals, again, who are working in the field. Phase 2, we're currently in progress. We're, collecting feedback from our residents via the meeting tonight, as well as an online survey that I'll kind of discuss in another minute. And then phase 3 is the release for the request for proposal, which we're really excited to announce that is live and is open starting today through June 16th. Applications are, again, available on our city webpage, and materials must be submitted ahead of the deadline. Again, that's Sunday, June 16th at 11:59 p.m. The City of Fall River has reserved up to 1.2 of the 1.8 million that we have currently for this initial funding cycle. This RFP process is a way for us to get the funds out into the community through organizations that are currently doing a lot of this work. Through this process, we want to prioritize Fall River residents. We want to improve and encourage new partnerships between community-based organizations and municipal departments. Collaborations is key, and we really want that to be part of strong applications. We want to improve data sharing, and that's going to be a key part of the application evaluation process. Applications should be evidence-based, have clear, smart objectives, and strong evaluation process. So we encourage, anybody who's eligible to apply for that funding. Again, it's on the city website, and it will be open through June 16th. As a reminder for anybody who hasn't done so already, the Fall River Opioid Settlement Fund survey is live through Friday. It will close on Friday. We've had an overwhelming response, which we're really excited about. We've received nearly 500 people who have completed the survey with a range of demographics, people with lived experience, people who are experiencing homelessness, who we certainly want to hear from, as well as people in the industry, concerned family and friends, community members. So we're continuing that work and engaging with the community over the next few days. But are excited about the response, and we'll be doing a data analysis of that and then be sharing that information once we've completed an analysis and report. So at this time, I'm going to open it up to our citizens' input. Again, do you want to mention? So again, speakers in the order that that you signed up in will be called to the microphone. We have it just right over here. If you're able to, state your name and address. And again, we're going to be keeping an eye on the clock. So if you could make sure you're limiting your comments to about 3 minutes. If we're going over the 3 minutes, I'll jump in and ask you to wrap up. Okay? Let's see. We have Dolly Mello.
Hi, my name is Dolly Mello. I live at 84 Stanford Street here in Fall River. I'm also a business owner. I own Heart to Heart Counseling here in Fall River at 331 Ellsbury Street. I'm a licensed alcohol drug counselor. I've also worked in the methadone clinic here in Fall River. And I wanted to talk about support treatment and recovery. As we know, on March 23rd, the Tomeo Center closed because of a grant issue that they had, but they serviced a lot of our residents with OUD. As well as I was able to go down there and talk to people and be able to network. They did provide laundry services, sanitation issues for helping people to take showers and use their facilities. They provided meals, and again, the wraparound services. So something as vital as like the Tomeo Center, who was vital for residents that were significantly, not just for homelessness, but also had mental health issues and had OUD, were able to use these services. And I would like to see something like the funds to be allocated to help them reestablish, because without those funds, those people their needs are not being met. Unfortunately, we know there's an epidemic here. We know there's a crisis with homelessness, and it is, what are we doing as a community to make sure that our people are taken care of, You know, I also work for the VTH here in New Bedford, so I also service the homeless veterans here in the city of Fall River. Most people know Dolly Mello as somebody that comes in and takes care of the veterans. I get them housing and get them from encampments into affordable housing or into treatment. But I actually took 2 veterans out of Tomeo Center because Lisa Mello had called me and said, we have 2 homeless veterans, and can you come down? And absolutely, VTH stepped up and said, okay, we're going to get them, we're going to bring them into treatment and get them housed, and that's what we did. Again, it was that kind of services there that was it was like a stepping stone so that I could come in and help. It's a place like that that we need in the city to keep on going. And with it being seized right now, I just think that there are not only veterans, but everybody that's affected, OUD and veterans, that are not being able to be met. And that was just pretty much what I wanted to talk about.
Thank you, Dolly.
Thank you.
Thank you. Let's see, we do have Al Aruda. And I do have a timer going, so if you hear a timer go off, it isn't my cell phone ringing. I'm just trying to keep track of the 3 minutes.
Yeah, my girlfriend warned me I should just kink my hose and that'll quiet me down, you know. So, no, I just wanted to preface this with, as someone experienced with the tobacco settlement funds, the way they were dispersed. As someone who smoked for almost 50 years, right? I tried to quit smoking for 15 years and never received any help with it. I finally did quit smoking, thank God. But I mean, you know, I think it's important that the money in these programs, right, especially at the state level, right, make it down to the communities and actually the people who are actually suffering from these conditions. I've been in recovery for about 40 years, and I've been totally clean and sober and all of that wonderful good stuff for 17 years now. There is a definite lack of a shelter which would accommodate people who are at the very beginning stages of recovery. And those stages are usually, you know, fraught with all kinds of difficulties. People relapse constantly at that stage. There has to be, I would like to see, you know, some kind of accommodation for people who are still relapsing, people who are having, you know, a host of tangential issues right in their lives, a place where they could go, you know, all day into the night, you know, wraparound services. I do like what the previous speakers talked about, but something that, you know, would actually accommodate a lot of the social needs that we see on our streets every day. My estimate was like, you know, 3 to 5 million probably to do something like that, you know, comprehensively. So I guess as a last and final comment, I'm kind of disappointed, you know, that, you know, $900 million is coming into the state and we're seeing like 8 million, which over 15 years is, what, $500,000 into the city? That's, you know, in my words, ridiculous. You know, we should be protesting at the State House. We want a much larger, greater share coming into our community, considering the impact that our population has suffered with this. Thank you.
Thank you. Let's see. Next, we have Mary Feidelberg.
As I understand it, we have an advisory committee of 10 people, correct?
Yes. Yes.
And I see 7 people at the front of the room. Where are the other 3?
They couldn't be here.
So we have 2/3 of the committee here? Are all of you members of the advisory committee?
Yes.
You 4 are, but what about the other table? Okay, great. So I commend you all for being present. This is an extremely important public meeting. I could read about the Fall River problem with opioids on the cover of the Boston Globe. They talked about how we had the #1 physician in the Commonwealth for opioid prescriptions. The reason is that this is ground zero for orthopedics because Fall River people show up for work no matter how much they are hurting. So it was a great place to come and prescribe opioids without too many questions asked, because we have a work ethic like nobody else. So it looks like our death payoff with interest is to receive $8 million over the course of roughly 15 years. Would that be an accurate characterization? I understand we have suffered an inordinate number of deaths per capita compared with other municipalities. So the state has roughly 150 communities, municipalities, and we probably carry, I would imagine, 5% of the total deaths, wild guess, which tells me we might have gotten shortchanged a bit here. I think the last speaker was probably, as they say, right on the money. I'd love to ask the state controller how much money is coming to Fall River for this, and how much we got from ARPA and the Inflation Reduction Act, also known as the Bipartisan Infrastructure Bill, or Build Back Better. Because my understanding is that the state got about $500 million from ARPA and Build Back Better alone, none of which was restricted. I mean, some of it had to go to infrastructure, but a lot of it could easily have gone into community health programs that would be covering much of this. Housing for our veterans, housing for the people who are sent here from Los Angeles International Airport and the INS in Boston by bus with a brand new iPhone to live here at childbearing age with no spouse and no education, many of whom are already suffering a substance abuse problem. So it seems like we have a lot of holes in our numbers. I don't mean to suggest any malfeasance, but we are the state with the worst government transparency. So if the state tells us we have to put the money in a particular account and use it in a certain way, that's what we're constrained to do. I very much appreciate you all being here, but I'm deeply concerned about our community's safety and viability. There is more to it than building high-rises all along our waterfront.
Mary.
And we need to diversify our community supports.
Thank you, Mary. We appreciate that. Thank you. Next, we have Nikki Fontaine.
Hello, everyone. My name is Nikki Fontaine. I work in Fall River and have lived here a long time. I've also personally been homeless here in Fall River for a while. I am a person in recovery, and I agree with the lack of transitional housing, wet shelter, or rooming houses. We can get people clean and sober through treatment, but then they're right back to the street where they started. Something more morbid that I haven't heard anyone say, because to me this really is like blood money more than a grant. We should maybe consider paying for funeral expenses for the people that are burying their child and can't afford it. And there's a lot of services here. Fall River's pretty lucky. We have a great amount of services that are finally starting to work together over the last few years. But one thing we have nothing of is something for people in recovery to do. There's absolutely nothing. And boredom and isolation were a reason why I relapsed 1,000 times. So, we can get people into treatment. They come back to Fall River. They can go to meetings. That helps, but it's 1 hour a day. A lot of other communities are opening up recovery cafes or clubhouses, a sober place with different avenues for them to express themselves, whether it's art, poetry, dancing, something in the city. I just think that's important and one thing that we have absolutely zero of. Thanks.
Thank you, Nikki. Stephanie Perry?
Hello, everybody. Many of you, my name's Stephanie Perry. I'm a nurse for South Coast Hospital, and I am an Addiction Street Outreach nurse. And I'm here today, one, to extend an invitation to the community for the hospital to be part of this conversation on a bigger scale so that we can maybe figure out, as a hospital system, how can we all partner together and create something that is long-standing and self-sufficient and is going to last much longer than we're here, right? Because the money's going to come for a long time. We might not be here, but the same issues will. So again, I'm hoping that that's the first thing, that we can have a bigger discussion in a more meaningful way with all of the partners, including EMS, the schools, the outreach components that we already have in place, and really identify the gaps and figure out, and I know you've heard this, Tess, I know you've heard this, Mike, we've said it at the meeting, but I want to say it again here. We really need to identify where the gaps are before we can make an effective change. And this committee, thank you all so much for being part of it, but you haven't had conversations with us, right? Pyre interviewed 17 of us, but you guys haven't heard from us. And that conversation was had with Pyre over almost a year ago, because it was, I think, in the spring of 2023. So things have changed. We have xylazine on the scene now. That wasn't even a thing. We have programs that have come and gone or are being rebuilt. So my ask is for the committee to allow us to have a more meaningful discussion with you guys so you can see where we're at, so we can move forward together. And the other one, and the most important, is really how can we bring this community together as more of a coalition of sorts that operates as one unit with harm reduction. We have all these services. We all work very well together, but we're not hitting all the gaps. And we don't know what those gaps are until you get everybody in the room and we really are able to identify. I can do this, but then I hit this point, but you can do that, and then you hit that point. Well, how do we mesh those two together so that we have a long-standing, effective change? And that's my big ask, is to really, can we have a bit more meaningful discussion? Can the committee either come to our meetings or invite us to yours? And I hope it's acceptable. Thanks.
Thank you, Stephanie. Denise Hoyt?
Hello, thank you for hosting, and thanks for your volunteerism. I'm Denise Hoyt, and I've been in recovery almost 26 years. So I have a couple of struggles with just even using the word opioid, because I feel like we forget about alcoholism, we forget about this crystal meth, there's people with just marijuana problems. So even STAR having the name of opioid, you know, it kind of leaves out a lot of people that might feel that they are not sick enough or have done enough to maybe even qualify for anything that's going on in the community. So that's one of my things. Also, I work at Family Service in the CSA program in the wraparound services, and there is nothing for youth. So with youth, we have traffickers going after kids in middle school. We have all the online threats. They use drugs as a way to get them to be in that sort of lifestyle. And we have nothing for them. We have very few substance abuse counselors that are actually within agencies or private that really have never really worked with youth. We had one place here that worked with youth and there wasn't enough access to it, so they actually left. It was like through the Health and Human Services. So that's my fear, is if we don't get people at the age of 10, 11, 12, never mind 16, then we are missing a whole generation of people. And it's never too early to educate. It's never too early to get them involved in ways that are fun, but they can also learn. And I think like there's a lot of different services that everybody has like a corner, but no one really comes together. And that's what I have found. Like, so, you know, I mean, wraparound came about because someone sued Mass Health, right? Because people weren't communicating with one another and kids weren't getting the treatment they needed, you know? And so, you know, I would hate to see, you know, all of that happen, you know, and I know there's a lot of barriers. I know insurance is a big barrier, you know, but I honestly didn't catch that beginning that we only got 8 million in that many years. I thought it was more than that. So I just feel like definitely we got to go to the State House. We got to do something. Like, we need more funds. Everybody always needs more funds, but I think that's my biggest struggle, is by the time that I get the kids on my caseload and then there's nothing for them. In the high schools that they could go to are voluntary. So teens, if they're not even willing to admit there's something, they have nowhere to even maybe get that education piece. And that's really where I feel some of the money definitely needs to go, because By the time someone's 21, they're already in. You know what I mean? By the time, so that's my biggest gripe about the whole thing. Thank you.
Thank you, Denise.
Good evening. My name's Seth. I'm the city administrator. So it's only 6:05, and everyone came out and had some really wonderful feedback and thoughts. I just want to open it up for questions, or if anyone else has anything that they want to say. We'll start it in a second, Mary Pat. But if anybody, based upon what other folks said, want to jump on up and I want to second that, I want to add to that, I want to say something, this is the time to do it. Otherwise, we'll open it up to questions, and we have some really knowledgeable people. I am not one of those knowledgeable people. I'm just the city guy. But we have some people that really kind of understand this universe and really have been working in different ways to make effective and meaningful change. So if you want to hear from the committee and you have questions, let's do it. Does anybody want to say anything before we start that? Go for it.
Hi there, my name is Sadie. I'm with River to Recovery. Actually, we have basically our whole team here, 1507 Pleasant Street in Fall River. So I think a lot of the speakers today have brought up some really valid points. I think Ms. Fontaine, what you said about having something to do for these people, right? Like we definitely, we bring them in, we do the meetings, they're wonderful, but then there's that boredom, that isolation that sets in, and what are the resources, right? How can we engage? How can we keep them active and excited and find happiness and joy again? And I think that's a huge piece that's missing right now. How do we help them find joy, right? And I think, I'm not sure who said it, but also allowing us to have a voice in the conversation, you know, inviting us to these meetings or coming to our meetings and hearing what we have to say. We are on the ground in the communities talking to the people, and we really have valuable feedback and valuable information for you guys. So invite us in or come to us, tour the facilities, be there. I know you guys are most likely volunteers. Your time is precious, but we open our doors to you at River to Recovery, and I'm sure many of the other community institutions as well. Come, visit us, talk to us. We're here for you. We can be a resource for you as well. So that's all. Thank you.
Thank you, Sadie.
Hi, everyone. Thank you. My name's Bill Kiley. I'm the Executive Director of the Boys and Girls Club. One of the things that struck me again was the piece about people being bored and needing a place to go. Well, there's lots of, I'm gonna guess there's lots of places similar to the Boys and Girls Club that have underutilized capacity during the day. You know, for us, the kids come to the club after school and evenings, but during the day, you know, we have underutilized capacity. And as far as, you know, obviously, treatment and recovery are the biggest pieces of where this money should be going. But as far as servicing youth to prevent them getting into that situation, Boys and Girls Clubs of America has a whole inventory of evidence-based programs, and we do it with kids every day. And as the person who was speaking said, a fun place for kids to be where they can learn and keep themselves safe. So just throwing it out there.
Thank you, Bill. Great.
Hi, I'm Danielle, at a recovery coach at River to Recovery in Fall River. And so I face some challenges in with the clientele that I serve. And I think, you know, the treatment for addiction is restoring hope. So they come in hopeless and jobless and familyless and homeless and all that. So we try to put all that together for them. I'd like to see some of the funding go for occupational training or job skills or getting the community more involved and giving people jobs, and mostly for maybe helping them when they first come out of treatment with funding for extended stay and sober housing, because they stay there for so long and then funding's cut off and they have yet to get IDs and such to get back to work, so it takes a little more time. So I just wanted to add that. Okay?
Thank you. Would anybody else like to say something? Okay.
So my name is Nadia Paquette. I'm a nurse, about 22 years in June. I'm a community nurse. I visit all types of homes, all in Bristol and Plymouth County, not right now. But I did work at South Coast for many years. I was just thinking back, you know, I see a lot of patients, ortho, heart issues, mental issues, always opioid a little bit with everything. Looking at allowable expenditure categories, you're missing late life behavioral issues, starting at 60. Have we done any statistics to see what age ranges have had the opioid epidemic? Do you have those numbers here for Fall River? The categories?
I don't have in terms of the numbers, the age ranges of overdoses. I don't have that information available right now.
Yeah.
Nikki, unless you want to speak to that, if you happen to have those numbers on the top of your head. Otherwise, there is a software program that Nikki's team has, and you can speak to that, Nikki.
Because I was thinking way back, my first degree is psych at BU, and I had attended Brattleboro Retreat. They have a wonderful program many moons ago that I did my psych rotation there. That'd be a great, valuable start. Obviously it's a volunteer. You had to admit yourself to that program. A lot of it is dual diagnoses, so you're focusing on opioid and how we can treat the disorder, not including the alcohol and dual diagnoses issues. And I think once we start with that and follow through that kind of program, and then have secondary and tertiary groups where they're improving, it would be very good. And that's how we can get them back to the workforce, the community, and keep checking in every month, or however the program would be laid out. But we need to work together more. The other part is on veterans. Are our veterans who need services, are they following up with like the Brockton VA or Elm Street in New Bedford, or Providence, so they can have those services? They have those services. So I'm not taking away from any veterans, because they are our community here, but we have they have those services that they can utilize. I don't know if we're connecting all of those to help. Those are my
Thank you.
questions.
Would anyone else like to speak? You want to respond? Go for it. You want to do the microphone, just so it's all recorded and stuff? Sorry, Nikki.
You brought up a lot of really great points. Thank you. I can tell you that the city is currently building a database called Gelada. We've been working on it for over the last year, because up until that point, we didn't have a very great means of tracking everything. So we do break it down by gender, age, Narcan administration, drug use, what substance was used, and everything we could possibly think of. We've added as we went. I can definitely, I don't have them off the top of my head. I can get them to test if you'd like, anyone here would like to see those stats. I know that we just had an overdose of a 71-year-old male on fentanyl who had no history or signs of opiate abuse. And just from reading the reports month to month, we do have a pretty fair amount of, I would say, 50-plus age range that does overdose. So you are correct in that. But I can get the exact stats for you to test and then by probably Monday. Okay? Thanks.
All right, question time. Mary Pat, you've had your hand up. Oh, there was one more person. I'm so sorry. I jumped the gun. I apologize.
I'm not sure if anybody already talked about this. I apologize, I was late. My name's Nicole. I'm the clinical social worker at River to Recovery. Something that always stands out to me in the substance use field is the the barriers for women in particular to access to care and to treatment. We've made a lot of efforts at the center to start like women's groups and do things like specifically to help women, but it seems to be harder to get women to come in, and I think that's an issue everywhere, not just specifically to us. So I would like to see funding go towards helping women break down those barriers so they can get easier access to treatment. I think there is still a lot of stigma, not just surrounding people who use drugs in general, but women in particular. Going off of that, I would like to see some funding go towards like more harm reduction efforts, maybe education about Narcan. I mean, it's always surprises me how much stigma even the substance use community has towards harm reduction, like Narcan, because I think a lot of people just don't know. And then Sadie and Daniel already brought up like the piece where it seems like we have clients that come in and then there's that period of time where they're kind of just stuck. So having like vocational training or some sort of educational programs to help them like kind of make that next step and integrate back into the community would be really great.
Great, thank you.
You.
All right, very quickly, before we open it up to questions, just to kind of clarify process a little bit. So the RFP, request for proposals, all right, that's launching today and is open for the next 6 weeks, is an invitation to organizations in the community to make a proposal to do the thing that they want to see happen, that they believe needs to happen in order to make a difference in this effort. All right, so as much as there are a lot of incredible ideas and perspectives on the committee, the idea is that the proposals and the ideas we want to have come from the community, and then the committee evaluates them, and then based upon the criteria that are in the RFP, and you can actually see that there's a number of criteria. There's how it's going to be rated, based upon how closely does it try to reach out specifically to Fall River people. If it's not just Fall River people, but it's broader, that's fine. That doesn't disqualify you, but there's a preference. There's a desire to really help the people that live in our community, if we can do that. There's a lot of other criteria like that, and that will help you sort of have a rubric to follow when your organization or an organization that you're familiar with or associated with wants to put together a proposal. So that's just so you kind of understand what we're hoping for to come out of this meeting, and the RFP itself is for organizations that need the funding to support a wonderful idea, give some structure to that wonderful idea, and submit it to the committee before the 16th. 16th?
Correct.
Great. Do you have any questions?
I stand up here and I think about people I've met. I think about the prostitute that I met in an ER who was addicted to methadone. I think about another prostitute I met in New Bedford. I think about my cousin who works with at-risk, high-crisis teenagers who did not get paid by Mass Health as a sole practitioner counselor for 12 months, starting in March a year ago, no paychecks. She submitted everything properly. She had been a therapist in Connecticut and Massachusetts for something like 15 years. And all of a sudden, the state decided not to pay sole practitioner counselors working with teenagers and kids, adolescents in puberty in crisis. So the mother commits suicide. And this is one of her patients. And what does she do when the state, she's in month 8, the mortgage is due. She's not seeing any income at all from all these paychecks owed to her by Mass Health. I don't understand how our state works like this. I don't understand how the Tomeo Center had to fold when Ms. Mello created it on her own, seeing a need down in the Bay Street area, and didn't get the funding, and it had to close its doors. I don't understand why we can't find a safe place for our veterans to live when we have federal funding and all kinds of programs, and we have never seen so much slush fund money in this state, in this city, in our lifetimes. So please, help us figure out how to deal with these problems, because those of us who have friends and neighbors who are suffering, the police who have to face these people, the whole issue of the police and record keeping is its own question. But I don't understand how this community keeps going sometimes, because I see so much suffering here. And these are the people who have seen it personally. That's why we're all in the room. And we want to care. We offer services in some cases. Like the Boys and Girls Club does an amazing job giving kids hope, giving them purpose, giving them a sense of fun and joy. But we need to integrate across all these different service providers and get out of the box of I'm social services, we are recreation, we are arts and culture, and work holistically. I keep hearing people say that. So I'd love to know who designed the survey and how we can incorporate this kind of thinking and problem solving and evidence-based results. Use national models we know work. Oftentimes it involves the parents. Oftentimes the parents are out of commission. So what are we doing to support these holes when so many of the people who come here are already in crisis? How do we help sustain people? How do we do the right thing and not shortchange those we know personally from childhood, from the neighborhood, from work? There's some very tough choices, but we'll never see the kind of money we have now. And I don't understand why we don't have 3 matching programs to go with this money. Because we've got the pockets for it at the moment. We could be drawing from all kinds of sources to supplement this and use this as seed money for related initiatives across the whole city. Where's Jake Auchincloss? Where's Mike Broderick's chair of Ways and Means? Where's Carol Fiola, the head of infrastructure? Where's our speaker pro tem, Pat Haddad of Somerset? These people are reconfiguring our census block groups and deciding that we're ineligible for federal support as environmental justice communities, unlike places like Wellesley and Nantucket, which don't have to go through the appeal process and get approved when their median income is 13 or 14% above the state average for those census block groups. We're seeing ours merged with richer waterfront neighborhoods on either side, contrary to census guidelines.
If I may, Mary, those are all really good questions, good points, big questions. Do you have a question for the committee?
Yes, what are we going to do to integrate across all the city's programs efficiently so we are thinking holistically about the needs of our community? I love the question about where are the data? Where are the deepest areas of need? And what are we thinking in terms of prevention so we don't end up with as many parents and kids in a pickle? And what are we doing to support the police who so often have to face these incredibly tragic and heartbreaking situations? Can we carve out any money for their emotional well-being and for the firefighters who respond to every Narcan call? Because those poor people burn out, and we need them.
No doubt about that. One of the things that we can't do with this money is essentially replace monies that are already being spent for police and for fire. Most of it's for new initiatives.
We can't augment it with new initiatives in police and fire?
Not really.
And across St. Anne's as well as South Coast?
So it's kind of a fine line, but that is a big piece of this, that we can't take money that the city budgets for police, for fire, whatever, and say, oh, we're going to use opioid money for that.
We can't augment it?
Not really, no.
That's not being done at other communities? I thought it was.
If it is, it's not really to the letter of the requirements. So.
Well, I'm here to tell you, when it comes to things like environmental justice communities, the requirements are malleable, almost ad infinitum. You'd be amazed how far the law can be stretched in Massachusetts.
I'm actually, as a lawyer, I'm never amazed at how far the law can be stretched. I've been stretching it for a long time. And so I don't disagree with you, but I think that the line is probably brighter than we realize. So I just want to give more time for other people to ask questions, if that's okay.
Okay,
Thank you for those great points.
have we had a dialogue with our sister communities, with Lowell, with Haverhill, with Brockton, to see what they're doing in spending this money and how they're finessing it to help create a multiplier effect across the community with help to other agencies. There's nothing that says we can't take money already budgeted for one thing and shift it a bit and then plow some of this money to offset that shortfall. There's creative financing.
I think it's debatable, but I hear what you're saying. So, but I appreciate
Thank
all
you,
the
Seth.
points you made. Thank you so much. Any other questions? Sure.
I just wanted to do a quick plug-in. My name is Sheila Chassie. I'm the Director of Housing and Basic Needs with Catholic Charities of Fall River, and I just wanted to do a quick plug-in just to put the word out there. We have a great program here in the city that the city does fund through our agency, and that's the Fall River Coordinated Entry. It is a service provider resource. So if anyone's in need of any service, not just related to homelessness or substance use disorder, any resource that they need, they can call the Fall River Coordinated Entry at the 774-520-2555. My staff, I have 3 staff daily that answer those phones from 8:30 to 5. And if there's a resource that they don't have, they're in front of a computer, they can obtain it. 774-520-2555. Thank you.
Thank you. Any questions? You got to use the microphone. I'm sorry. I'm sorry, Stephanie. I made Nikki use the microphone, so you have to use the microphone.
I just have a quick question. So I know the deadline, it opens today and it closes June 16th. Is there any way that that can be extended? Because if we're really going to be meaningful with this money, we have to have bigger conversations. And I think a month and a half doesn't really help us with that situation. So is that a hard stop, June 16th?
After 12 months. It's 12 months as of June, right? Did all this start rolling? So 6 weeks of review seems a little slim.
Right.
So,
Like what is the reasoning for that short time frame of turnaround? I'm just curious.
anybody else want to? I don't want to dominate this. I don't want to be the answer guy. All right, I'll give you an answer. All right, here we are. All right, fair enough. So this is actually my job in government centers, answer terrible questions and be the bad guy. So here we are. So there was a 6-week opportunity for organizations to get their proposals together. After that, they'll be reviewed. And what we imagine happening is that based upon the proposals that come in, there'll be additional conversations with the applicants. So similar to the way the ARPA money was handled, for anybody that applied for ARPA money, there was a review period, and then those folks were invited in to have a conversation about the application, to understand whatever questions might have, to have the opportunity to really make the pitch to the committee. And the idea would be for once an application, if it's in fact allowed, if it's endorsed by the committee, that the money would be distributed in the fall. So what we wanted to do is try to create a period for people to put together applications, knowing that a lot of folks have been anticipating this for quite some time, that they knew the money was coming, that they knew there would be an opportunity to apply for the money, 6 weeks to formalize the application, and then a review period. That review period is more open-ended, and so by early fall, end of the summer, September, October, the idea is to be distributing the money.
Again, though, it is a very slim amount of time, right? It's a very short amount of time. If we're going to have bigger conversations, those conversations take time, especially if, in my thinking, if we don't want to operate in silos, we need to combine our efforts, right?
Sure.
So if I'm going to combine a hospital effort with another hospital or another community program, it takes time and planning on our level to just go to the top so we can get approval on even the proposal. And 6 weeks isn't a long time of a turnaround, especially for a hospital system and for many community agencies. So I think if we could just really think about that and maybe have some exceptions to extend that. I know with the opera funds, it was kind of more of an ongoing, where this is now open, close. And it just seems like and you know, this room isn't very full, right? So the people who know about this are the same people who always know about this. The people who could also benefit from this conversation might not even know that the conversation's begun, and might find out 2 weeks from now, which then gives them 4 weeks. You know, so like, as a community, I just hope that we can extend that deadline.
Because we see it in the paper or whatever after the fact.
Right.
We see
Right.
that the real estate guy was here talking about housing development. After it happens, people don't know in time to show up.
And it truly does take a long time for a turnaround in a hospital system. And the hospital systems, both South Coast and St. Anne's, has committed to working together in maybe collaboration with the FAST team or EMS or the schools, all of us together. But that is a big ask to have a 6-week turnaround.
Right at the start of the fiscal year, too.
Mike, you want to jump in?
Sure.
Mike, you got to use the microphone. Sorry.
Okay. Can I use this one?
Yeah, that's our mic.
Okay. All right. Speaking only for myself, in response to Stephanie's comment, I'm very open-minded about what you're suggesting, but I do want to say that we want to balance that along with the feeling that we want to get the money out, because there has been some criticism of the process that the money didn't get out fast enough too. So it is a balancing act. So I'm sorry. The committee will be talking. We're going to, at our next meeting, we'll go over everything that we've heard tonight, and that issue of whether it to be extended. I guess we'll discuss it, but understood that the other push against us is to get the money out. Once a month.
All right, so we'll have a conversation. We'll have a conversation about extending the deadline. Is that okay, Tess? Yes. All right. So we're going to have a conversation about extending the deadline. All right. I think that's fair. It's an absolutely reasonable request. I want to push back a little bit around the conversation, because this committee, although there are a number of folks on here in this committee who are very capable of participating in that conversation in a very knowledgeable way, this committee isn't a policy committee. It's more of an appropriation committee. So if there's conversations to be had, I think there's folks that are glad to be part of them, but the very reason why members of certain organizations, kind of the big organizations, the people that could ask for this money are not on the committee is, I think we were thinking that the conversations are going to be had in the community. That formulates the proposals, and then we look at them. If anybody has a different perspective, please speak up.
I agree. There's definitely a concern about potential conflict of interest by putting provider agencies on the committee who would then apply for the funds.
But we need some time and notice to review it and prepare notes and come up with plans that will be as productive as possible for the money.
Yeah, understood.
2 weeks, it's not the end of the world.
I agree. So yeah, we can have that conversation. We'll put that information out if we can do that. I think part of it was the idea of, if we distribute the money in the fall, for those folks that are on a calendar fiscal year, then they could anticipate from a budgeting standpoint being able to put their programs in place starting January 1st. That was certainly part of the conversation. But if there's a way to extend it, I think we can have that conversation. No promises, but we'll talk about it. In terms of the conversation, I would just say that I would hope that's happening in the communities that are doing the work, because what we actually want more to have that conversation happening, and then have it yield proposals that we can look at that are amazing and that are transformative, that we can then help to fund. So, but we're not here to tell the community what it should be doing.
We all want time to talk to each other, to try and talk to people in sister cities, if you will. Look at our comparables and go, what's working and how are you going to do this, and how do you spark further funding with this initiative? What works? Instead of each of us inventing the wheel.
I just plug in here that the city of Fall River holds a monthly meeting once a month, that via Zoom, and the community development agency, you just email or call them, they'll give you that Zoom link, and that might be a great time to have some discussions, just maybe what service providers are thinking, and get the word out there. They might go, is this, make this proposal? That might be a great resource to gain a lot of information about this.
Great. Thank you. Yes, sir.
So, one of the concerns I have is the fact that this is really
compared to the kinds of needs that are present. Has anyone considered on the committee an idea of like floating a 15-year bond for like, $7 million, right? And then using this money over 15 years, paying the bond off, and then, having an actual real impact on the need that's in the community.
So that would actually, somebody on the committee would end up in jail if we did that. Yeah, and so, no, it's actually kind of a wonderful idea in terms of how to make the money go farther and have it make an immediate impact. But when you have something in a stabilization fund and the way this money is actually, it would be really, really bad. And we've already kind of done the whole jail thing. And we're trying to move past it. Right, yeah. So, yeah, it's just not, it's not allowed. I'm sorry. Yes, ma'am.
How much are we getting? Because I missed that.
About $8 million. Over, yeah.
So, and then where's that 60% states, whatever, what was that? I missed that.
All right. You want to do this?
I can if you'd like.
I keep asking my friends here to come up. Thank you for coming
I
up.
can talk.
And they're just like, no, you're on your own. So that's awesome. Thank you. All right. 900 million to the whole state. All right. So 40 million is actually 40% is directly to the communities. All right. So if we have 900 million, that's 360 million directly to the communities. We got 8. Right.
And if I could, so this, yeah.
8 total.
60%
goes to the state.
So the state, that's going to the state remediation fund. So at this point in time, the state remediation fund has a number, and again, this is all publicly available information. But in terms of expansion of harm reduction, they've committed $3.4 million, the state remediation fund, to that. So implemented community naloxone purchasing program. They're developing certain grant opportunities for municipalities, funding syringe service programs in Brockton and Worcester, things out in Western Mass. There's a variety of things going on, but no, there hasn't been anything in Fall River at this time. Increased access to medication for opioid use disorder, $3.1 million. That's expanding access to medications for opioid use disorder, new mobile methadone delivery programs, new medication unit for the Middlesex House of Corrections, workforce development, expansion of supportive housing programs, that's $6 million for the housing programs, and $15 million for workforce development. So there's a range of programs that the state remediation fund is working on. Those are happening throughout the Commonwealth. So yes, and that's all publicly available information.
But I have one more question
sure,
to that.
Sure.
So when we write these grants for Fall River, for CARA and all that stuff, opiates, the data, the census data nationally is that Massachusetts is the 10th largest city in the state, but for all of the last year since 2016, we were in the top 5 for opiate overdose fatalities. So I'm just really confused where they got that we only get 8 million.
So the model, there was a model that was created at the state level with lawyers and experts. That model allocates settlement money using 3 different factors. The U.S. Health and Human Services data on prevalence of opioid use disorder in a county from 2007 to 2016. The factor number 2 was CDC data. Sorry.
That's right.
2007 to 2016. The factor number 2 was the Centers for Disease Control data and other federal data on overdose deaths from 2006 to 2016. The third factor was DEA data on opioid shipments from 2006 to 2004 to the county. The model then allocates dollar amounts based on U.S. Census data showing how county municipalities have historically split funding for government functions relevant to opioid abatement. So this, again, you can find this information outlined on the state website.
You spoke a little, that last one,
Uh,
you spoke
the-
a little rapidly.
Sure. Those three factors were then compared with U.S. Census data showing how county and municipalities have historically split fundings for government functions relevant to opioid abatement. So that was the formula that was
So it's based on all the
used.
ways we've been shortchanged in the past. A third of the decision-making is based on our history of being shortchanged.
So that is
For
how
a
the
county and
funds were
municipality.
allocated. And unfortunately, at this time, and it's very clear on the state website, that the funding amounts are not, they are set in stone.
All right, we actually have some insight onto this.
Well, here's one way to think about the concerns about how much Fall River is getting. The state is getting $900 million, right? 40% of that is going to 351 cities and towns in Massachusetts. 40% of $900 million is $360 million. 351 cities and towns, that averages to about $1 million per community. We're getting 8. So that is,
For how many years? 15 years?
for every, yeah, all of it is spread out over 15 years. All of these figures are across 15 years. So we're getting 8. So we are getting an amount that is based on our population base and as well as the extent of the problem. So compared, there are a lot of communities that are getting very modest amounts in the hundreds of dollars, and they're not happy about that either. So it's a limited pie that's being split up in the best way that admittedly the experts decided to do. But the formula was imposed on us, and there was nothing that we could do to change it.
But we have the chair of Ways and Means in the next town.
The
There are things
state
we could do.
legislature was not at the table when this was discussed. They
Yeah, I
had no
know,
role in it.
I know.
Senator Roderick had no role in.
He has a role in everything.
Not in this.
So basically, the people who have 540 million of this are the ones who decided that we should have what we have.
No, they didn't either. The formula was decided among those who negotiated directly with the
But who
drug
do you
companies
think
who
they
put the
are?
money in.
That's who that is. But thank you.
Any other questions? If not, I think we're going to wrap up. Any last, yeah?
Is there any appetite for the panel to have collaborative proposals where you have one grantee that's the lead agency and then others that are in it?
So this panel is so open-minded, it's almost ridiculous. If there are organizations that want to collaborate to try to do something where it leverages the respective strengths of the different organizations, and you want to bring a proposal, that's fantastic. One of the reasons why, if you look at the RFP, there's not a ton of limitations and constraints on things like that, is that we want to see, things that change our city. And if that requires, you guys do certain things incredibly. Like you're doing it for the youth initiative right now with ARPA. To me, there's no question in my mind that there are things you could bring to bear as the Boys and Girls Club that a lot of other organizations couldn't do. But at the same time, there's folks like River Recovery that are doing their thing exceptionally well as well. And there's other organizations. I don't mean to just single those two out, but you guys are here tonight. If there's a collaboration, this panel is going to be open to it all day long. I'm not saying that it's going to be the successful one, because there's probably going to be a lot of really good applications.
No, I just think that would be one more benefit of extending the deadline a little bit longer, give people the opportunity to consider collaborative efforts.
In fact, the rubric indicates that applications that do have collaboration amongst more than one or more community partners will be evaluated highly. You'll meet the excellent category for the rubric evaluation.
I should have read the rubric closer. It's on the RFP.
That's correct.
Yep. Anyone else? Yeah.
So, will the funds be going to create new programs, or the funds be going to existing programs? Or both?
So the goal for these funds is to either create new programs or expand upon existing programs. So we can't put money towards a program that's currently funded. It has to be an expansion or, you know, an addition to a new program. So that's the focus of these funds.
Anyone else? Going? All right. Thanks so much. All of our, well, at least Tessa's email and my email are easily found on the Fall River website. Tessa's Director of Health and Human Services. I'm the City Administrator. I'm not going to offer these nice folks up yet, but there are ways to get in touch with us. So if you have more questions, feel free to call, and we can put you in touch with the right person. Likely Tess is the right person. I'll have to put you in touch with the right person. And appreciate so much the questions, the thoughtful insights and advice, and looking forward to some really excellent proposals, and we'll have that conversation about extending the deadline.
And just in terms of another email, we did create an opioid funds. It's up on the screen. Opioidfunds@fallriverma.gov email address. So any questions you can, Brianna and I both monitor that email. Thank you so much.